This video shows an example of a normal gait pattern. A normal healthy gait pattern is fluent and coordinated between the arms and legs. However, with an injury, this is not the case and often leads to protection from pain. During initial contact of stance phase, the heel strikes the ground and the quadriceps contract concentrically to place the knee into extension. The hamstrings stabilize the knee, the hip extensors and abductors stabilize the trunk, and pelvis and the dorsiflexors contract concentrically to control the lowering of the foot to the ground. Moving into loading response, foot flat is achieved and the weight shifts onto the stance limb. The quadriceps work eccentrically to control knee flexion, the hip extensors contract concentrically, and the dorsiflexors work eccentrically to control the lowering of the foot, and then the plantar flexors work eccentrically to control dorsiflexion as the tibia moves over the foot. Moving into mid-stance, the body progresses over the foot and now the quadriceps are working concentrically to bring the femur forward. The ankle moves into slight dorsiflexion and the plantar flexors are continuing to work eccentrically to control the rate at which the leg moves over the ankle. During terminal stance, the body progresses over the foot and now the heel comes off the ground to move into the push-off phase. The knee flexors work concentrically and the plantar flexors continue to work eccentrically. Lastly, during pre-swing or toe off, both the knee flexors and plantar flexors are working concentrically to push off into the swing phase. During the initial swing, the knee and hip continue to flex, and the ankle moves into dorsiflexion. Therefore, these muscles are working all concentrically. During mid-swing, the ankle dorsiflexors move the ankle into neutral and work concentrically. The hip flexors work concentrically while the hip extensors now work eccentrically to control the lowering of the limb. Lastly, during terminal swing or deceleration, our ankle dorsiflexors continue contracting concentrically to keep the ankle in a neutral position and the knee begins to extend. The hip extensors contract eccentrically to slow down the leg and slow the rate of hip flexion. When we make a change to our gait pattern, we expend more energy than we should. Staggered stepping, limping, and uneven stride length all require muscles to activate while walking that are not used to being overworked. This can result in fatigue, soreness, and instability. By maintaining a normal gait pattern, individuals will be able to walk further, longer, and not use as much energy on a task that all of us do every day. This video shows an example of a person without right hip extension. Immediately, there's a difference noticed from normal gait. Having no hip extension eliminates terminal stance, pre-swing, initial swing, and mid-swing stages of gait. Arm swing decreases to nearly nothing, decreased knee flexion, and no posterior pelvic tilt or lumbar flexion, yet dorsiflexion remains the same. The only muscles that work differently with this abnormality compared to normal gait are no concentric hip extension at any stage, and less concentric knee flexion and plantar flexion during terminal stance, pre-swing, and mid-swing. A person with this abnormality might begin circumducting their lower extremity when trying to walk faster, since they do not have that strong toe-off stage to propel themselves. Excessive lateral spine flexion or normal spine flexion could occur to help more effectively move the body without hip extension and be an adverse reaction to the circumduction of the lower limb.